Okay, next we're going to talk about culturally competent healthcare. So, culturally competent healthcare is the ability of providers and organizations to understand and integrate individual values, beliefs, and behaviors about health and well being into the delivery and structure of the healthcare system. So, the goal of culturally competent healthcare is to provide the highest quality of care to every patient, regardless of race, ethnicity, cultural background, age, sexual orientation, English proficiency, or literacy. And it requires you, as the healthcare provider, to know the potential areas of conflict. So, first, let's look at the three basic concepts of health beliefs. Biomedical is the first one, so that's what we view as our traditional medicine. Alternative or complementary are therapies that are not regarded as normal therapies in the medical field. So things like herbalism, acupuncture, homeopathy, all of those are considered alternative or complementary therapies. And then the last belief is a holistic belief. It's a form of healing that considers the whole person. So it doesn't just look at the disease, it looks at everything that's going on that could be causing the disease or the disorder. So they've identified 11 areas of potential conflict within healthcare that you as a healthcare provider need to be aware of. You have to understand the differences so that when you are interacting with a patient, you're not infringing on their cultural beliefs or values. So these areas are wellness and health prevention, touch and physical space, communication, general procedures, examinations, things like that, dietary needs, spirituality, views behind death, views about medication, pregnancy and birth, pain management, and then we'll talk about another category. So looking at wellness and health prevention, different cultures view wellness and preventing health in different ways. So an example is that we Americans tend to focus on healthy living and disease prevention. American Indians view weight gain as a normal occurrence in adulthood, so dieting is seen as senseless and foolish. Some cultures don't value immunizations, and others view it as injecting poison. So it's important that you recognize the cultural differences. So touch and physical space. Some cultures, close touching and human contact is a sign of respect and friendship. A simple handshake or a smile shows warmth and caring. In other cultures, direct hand contact is not okay, and it's seen as an invasion of privacy. For example, Muslim women should not be touched by men who are not immediate family members. Personal distancing varies, so be alerted to positive and negative signs that tell whether the patient is comfortable with the amount of space you're allowing. Communication is the next area, so think about communication and how that could be a potential barrier. Obvious one is language. Some cultural groups find it taboo or insulting to discuss any type of sexual activity, while other groups are more willing to. In matriarchal societies, the oldest woman makes all the healthcare decisions, but in patriarchal societies, the eldest male makes all of those decisions. And in some cultures, women must look at their husbands for permission to speak. So it's important that you're aware that these differences exist. So dietary needs. As you know, food has many ethnic and religious implications. Some cultures do fasting rituals, and all attempts should be made to accommodate any of these types of rituals. All attempts should be made to accommodate a patient's nutritional needs. For example, there are groups of people who do not eat pork, or they don't eat meat on Fridays, or fasting during Ramadan. So it's important to explain why certain foods should be avoided for specific diseases like high cholesterol or diabetes. Again, Americans view meat and milk products as staples, but in India, they don't eat beef or drink milk. So spirituality is the next area. So when we talk about spirituality, that's basically about finding, the higher meaning in life, or the basic meaning of life. Regardless of beliefs, the patient's belief should be accepted. You should never explain to a patient or say to a patient why their view is wrong or faulty or inaccurate. The healthcare workers should try and always use correct terminology when discussing anything as a sign of respect behind spirituality. You should not, inject your spiritual beliefs. If you believe in God, you shouldn't say that. You should try to use their terminology. Again, recent studies have shown that prayer is very powerful and can provide harmony and balance to the patient. And we need to be aware of this and allow privacy during these prayer times. Death is another area. Views on death vary greatly. Some see it as finality, meaning that's it, that's all that happens, and some see it as going to another place. So there's different rituals that surround death. Muslim patients should have their heads tilted and facing Mecca. Mexican Americans prefer to be in the room with the patient, while Japanese Americans prefer not to be in the room with the patient when they die. Death from suicide also has many cultural implications. So some cultures believe that it brings shame on the family. Others say that it's forbidden. So we need to be aware of these differences. Medication. Actions and side effects of some medications may vary on the basis of patient ethnicity. So women from Islamic and African countries with vaginal yeast infections prefer oral drugs to vaginally inserted medications. Latin Americans prefer injections over pills. Some cultures practicing religious fasts, which can affect medication schedules or intervene with drug absorption. So if they're not eating, they may not take their medication, or their medication may not work as well. And then pregnancy. Many beliefs behind pregnancy and birth. So in North America, male partners are involved with prenatal care visits, whereas some cultures, it's not encouraged. Some cultures have specific post-placenta delivery rituals. Some have ceremonies, burying it in the ground. Some cultures participate in placentaphagia, which is actually eating of the placenta for medicinal value. Pain medication. Some cultures believe that pain is caused by demons, and it's a sign from above that the spirits are upset. So they may refuse to accept or admit to pain. Other cultures see pain as a symptom of illness, while some may see it as a sign of weakness. Some other things to note. Cultural or religious beliefs may cause patients to refuse to give blood or transfusions. They may refuse to donate or receive organ transplants. They may refuse to place an elderly patient into a nursing home. The view behind fertility control, birth control, and also mental illness is big. So general procedures to think about when you're working with a patient that is different than you. Removing any type of clothing or hospital gowns can be difficult. A healthcare worker, you have to be sensitive to this. Before entering a room, make sure you announce your arrival. Some Hmong people fear a surgical incision because they fear that the soul may become frightened and leave the body. So what are strategies for dealing with all of this? We've talked, stereotypes can be unlearned, and that you can put things into place to minimize their impacts. We talked about implicit versus explicit bias. Recognize when it's happening in your mind. Stop and think, am I stereotyping? Am I forming a favoritism for or against? Understand prejudice and the damning effects on individuals, family, and society. Don't ignore it. Practice empathy. Empathy, again, is how must it feel to be a Black American in today's society? Or how must it feel to be a Muslim? Or right now with COVID, to be an Asian American? Treat differences as strengths, not weaknesses. Learn to be tolerant and teach others to be tolerant. Increase contact with other groups. If you're unfamiliar with a group, get familiar with it. If you don't understand transgender community, get familiar with it, learn about it, research. Read, take classes, get involved in groups, clubs, and activities. So your task is going to be to select one of these ethnic groups and or religions, and you are going to investigate what is the impact, what do we need to know as a healthcare provider in order to effectively treat and care for them. It is up to you which group you choose. However, I am requiring you to choose a different ethnic group than your own, and more information will be forthcoming. So to review, not everyone in a particular ethnic group will agree with these examples. Again, when we study human behavior, we look at the whole. There's always differences that occur. Nothing is ever, always, or never when studying humans. When healthcare workers ignore cultural differences, your patients are going to suffer. And patients that don't trust or respect their healthcare providers won't follow the treatment regimens. All right, thanks.